Casualty 911, 10 a.m. to 11 a.m. with the consultant. Health is not merely the absence of diseases. It is your social, economic, physical, spiritual, and mental well-being. Just imagine you on 88.5 Super FM talking, questioning, sharing your experience, information, education, entertainment, news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy, sex.
Sex? Did you say sex?
As prescribed, take your medication, exercise, and diet. On 88.5 Super FM, tell a friend, call your neighbor. Casualty 911 is on.
Good morning, everybody.
Spirit of Marilyn calling me audibly, boiling. She said that she would
here today. It's a pity we had some little technical difficulties, but today is going to be an exciting show. A show that is, that will be very beneficial to many of us as community members, especially our men, women of childbearing age. And today we have a very, very special guest. But before I introduce our guest, let me just say good morning to all our listeners from Connery, Soufresh, Schwurzel. Good morning to all the staff at Hotel Shokula, especially the agricultural section. All those persons that have been listening to the shows, giving feedback, good morning again. Let me just say a warm welcome to all our doctors and nurses in our wellness centers, as well as Soufre Hospital. So good morning again to everybody. So today we have a special guest, and I'm not going to introduce her. I'm going to allow her to introduce herself. It's always nice that we have her on the show, and we hope that in the future she will be coming to our show again. This topic we have there is so very important, especially to our Soufre, Choiseul, Connery's region, and island-wide for that matter of fact. We have these services, we have been talking about it, but many of you tend not to understand how the services work, as well as, taking advantage of all these services. It's here for you, community members. It's here for you, to take advantage of, to learn about it, to get a good feel of what it is. And it's for your own benefit, health-wise, yeah? And not only for you, but family members, getting our children, getting accustomed to our medical system, especially our young men over the age of 20, 18. That is the ideal time. And we really want to see those persons coming to our wellness centers, hospitals, and utilizing these services. So without further ado, let me just allow Doctor to introduce herself. Doc, go right ahead.
Good morning, Louisa. Good morning, Casualty 911, Soufre and its environs, and the rest of St. Lucia, whoever's listening on. I just want to say I'm happy to be here this morning. And Louisa, I'm thankful that you invited me to be able to speak a bit about universal health coverage. Yeah. So I just want to say that when we speak about universal health coverage, we want persons to know that universal health coverage is we really want everyone to get the health care they need when and where they need it without going through financial hardship or ruin. And that's very important. We know healthcare is very important and that it is costly as well. We cannot pretend that it's not costly. The Ministry of Health, Wellness and Elderly Affairs wants to have been working on a basket of services, which we call the Essential Package of Health Services, where we really want everyone to be able to access these services under UHC. And these services in the Essential Package of Health Services are basically the illnesses that make us unwell or really kill us in St. Lucia. Yeah, what is our burden of diseases? So when you're looking at the services we're offering, is to combat diseases such as cancer. We know that cancer is something that's really affecting St. Lucia. St. Lucians, you know about hypertension and diabetes. We're also looking at other services that we're giving, such as dental care and eye care and mental health services and maternal and child health services that are very important as well. Nutrition services, which is also important. We recently added snake bite prevention and treatment. And I think that's important because the farmers in the areas of Ancillary and Soufre and Vanna and Micoud and Denry, Pale, they would obviously know very much about the effects of snake bites. So therefore, we had to add snake bite prevention and treatment to the package. So we're looking at other services like kidney care and etc., sickle cells, TB, HIV, which are just some of the common illnesses that we fight with in St. Lucia. So we thought it was necessary to put it within the essential package of health services. Okay, now I like to present in English and also speak a French Creole in it because we are bilingual state. So, dès lè m'a commencé à parler, nous avons mettre un petit patouan dedans aussi. Pour ce qui m'a voulu, tout le monde comprenne ça nous ka fait about universal health coverage. Ça nous ka créer santé pour tout. Santé pour tout, nous voulons tout le monde savent, nous voulons tout le monde recevoir caillou ni pour joindre les yo vle, côté yo vle, si yo vle situation, côté yo fond ou yo pan là pour payer pour santé yo. Ministre santé Biete et zafè gon moun, ha commencé parler about service là nous vle tout set listien. Et puis ne m'a parler about un panier service, un panier nous ni pour moun qui malade set ici, qui ça qui a fait nous malade, qui ça qui a tué nous set ici. Et puis ça c'est bail, ça c'est service ça, nous ka ni pour mettre un panier. Nous ka parler service cancer, maladie cancer, pressure, pisadou, nous toujours ni pour check zie nous check dans nos archives nous tout ça c'est bail qui plein important COPD nous savons c'est jeune bougla yo ka fumer chai et plein nous fini kan COPD sickle cell asthme tout ces bail ça la maladie ça HIV TB c'est madame là Léon 7 go boudé nous pour bail au service ça aussi mental health ça c'est bail qui très important et qui affecte chai moun nous ni serpent nous savons cette ici nous 4 different type of serpent yon qui très mauvais si pichou il ça chou nous savons nous ka créer fédilance nous mettez ça en panier aussi pour ce qui nous savent ça c'est bail qui très important pour prevent moun nous pas vle serpent pichou mais si pichou nous ni service pour aider pour aller à l'hôpital là et puis nous ka couvrir tout ça bas UHC on santé pour tout. Okay, so we have started launching these services, Louisa. We have started launching these services. In phases, we have started launching some of the services that I mentioned in the basket. And I will tell you which services we have started launching. Okay, so we did maternal and child health services where anyone who is pregnant in St. Lucia can call the nearest wellness center to find out when is the antenatal clinic. And they will be able to get what you call, in addition to seeing the midwives and getting the services that they need, all the lab tests they need to get through the wellness center for the pregnancy and all the ultrasound through the wellness centers, they can get it at no cost to them. Okay, and that is a service that have started in May of 2023. The women are coming in large numbers. Of course, the numbers are not so great because our birth rate is dropping, but we are happy to see that the women are coming, and even those who have their private obstetrician gynecologists can access these services as well through the wellness center. We do not discriminate. We want persons to access the services through the wellness centers. So, mon ka dire patwa aussi, toutes ces madame là qui acceptent, ou ça aller à n'importe wellness center kouye, mon wellness center, ça nous ka kouye avant health center qui pou kayou, mande yo, qui jou yo kani clinique là pour ces madame là qui acceptent. Yo sa aller à là et puis non stakay we yo. Mais yo sa joindre toutes ces lab tests là ou ka fait durant temps ou en 7 quoi madame et toutes ces sondage là on y pour faire pour comment est ou ka fait quoi madame comment est petit bébé ka fait un matrice sur toutes ces bail ça c'est ça bail qui très important pour ça joindre ça mon pas pour payer pour ça so ça c'est un bail qui a commencé nous commencé 2023 mai l'ENESA et puis c'est un programme qui a couru bien. Okay, we started another service as well, cervical cancer screening and HPV testing, and that's important because cervical cancer is a sexually transmitted disease, And as a result, we want persons to be able to get their pap smear. Now, we used to do pap smears at the wellness centers before. I want to make that abundantly clear. What we've done under UHC is make it even more advanced, make it more advanced. And in that way, we would allow the women to not only get to know if they have an issue, but what strain of HPV, the human papilloma virus, that would cause the cervical cancer, because not every strain of HPV, not every type of HPV causes cervical cancer. So we have an HPV testing. Thank God, because of that method, which we call liquid-based cytology, it will allow us to know the type of HPV so that the woman can know, or the health workers can know whether this person has a strain of HPV that is cancer causing or not. Okay, and that's a good thing. You could also use the sample to know that same sample to know whether the person have another form of STD, okay, on that same sample. And that is very important. It's easier for the woman in that it's quicker, and also you can get so much more information from that one sample you've taken. OK, ça c'est un qui très important pour nous, because nous savons avant, et puis moi je vous dit, nous toujours qu'à faire pap smear avant au wellness health center. Ça c'est un qui était là en chaiton. Mais le problème là, c'est ça, à présent, là, de là où il y a un petit petit glace, il y a mettre un swab là, il y a cassé, là où il y a aller pour check ou vieux qu'il y a madame là, ou dit madame, la cassé, on est pour vieux faire l'autre sample, il était testé encore. So, quelle manière nous avons fait, c'est une manière qui est plus advanced. Si il n'y a pas rien pour casser de ça, à présent. Mais là où fait, ou qu'ils savent qui strain ou qui type of HPV ou ni qui cause cervical cancer, because pas tout strain qui a HPV qui cause cervical cancer. Et puis, pas ça tout seul, ou qu'à servir même sample là pour savoir si mon a l'autre maladie. OK? A l'autre maladie, a l'autre infection. So, ça c'est qui est très important. Et bon, c'est madame là qui a tester ça. Yo dit nous, ça c'est qui est yo aimé pour ce qui il a fait, il pas, vous savez, là, il fait, you very uncomfortable. OK? Après, manière, you fait, c'est madame là, par ça, you a call. All right? So that's important. So the women are coming, and we are very happy that the women are coming for that test. Because World Health Organization is actually pushing us to do elimination of cervical cancer. So we cannot be left behind as St. Lucians. We need to push towards elimination of cervical cancer, and therefore we must offer our women in St. Lucia the access to that type of pap smear, which allow us to be able to follow and do the necessary to try to eliminate cervical cancer.
So, Doc, let me ask a question. One of the things, a lot of the women, they kind of like the new sample collection technique. But when it comes to picking up the results, some of them, and that's one of the things we have in our region, you call them up, come and take the results. There is that little fear for the results. So what message you have for these women that they come and do it? Yes, but when to collect the results, that is one of the problems.
Well, Louisa, you can well understand, some people are afraid, yeah? And like every other test, when you do your certain test, your kidney, your liver, other type of test, oh my God, I'm doing the test, but I'm afraid of the results, One of the things we need to tell you is that cancer screening is really helping you for early detection. And when you can detect a disease very early, it actually you stand a better chance of being able to do any intervention before it gets too late. Okay, that's why they call it screening, because you want early detection, and if there's an issue, you'll be able to cut across or intervene, so that the person doesn't get worse. We also have the colposcopy clinic through at the wellness centers as well, so that persons with issues with abnormal pap smears, the midwives or the district medical officers, who are the doctors at primary healthcare, will refer these cases to the obstetrician gynecologist who works at the primary healthcare. Now, we have an obstetrician gynecologist who runs the colposcopy clinic. Okay, and that particular gentleman, Dr. Paul Cuslendor, was brought on board to be able to run the colposcopy clinic. So abnormal pap smears will be sent to him so that he can do the necessaries, the quick intervention to prevent persons from getting worse. Okay, that's important. And he was brought in for that. Okay, so moi ça veut laisser madame là nous pas nous paie. Nous ka fait test là, mais nous pas venir pour results là. C'est nous ça ka couiller, nous pas comprendre, nous pas tan, nous pas répondre phone là. And nous comprendre because nous comprendre parce que des gens ou pay ou pas savent. There's a fear in knowing. But the detection raison pour ce qui nous ka fait test ça, pour ce qui nous voulons moun connaître. Si vous savez a bail bonnet, nous ça fait a bail pour aider pour pas venir plus grave. Nous pas voulons venir plus grave. Pour ça nous ni test ça. So là où ni mais savent de les moun ka senti ko yo paix répondre phone nan vini parler non ça c'est non ça kay parler pour et puis si on y a un problème yo kay vo pour voir docteur Lendon on dit de colposcopie clinique là c'est clinique ça yo health center même yo kan c'est clinique ça non ça kay qui joue côté yo ni clinique ça so docteur Lendon kay vini yon c'est docteur nous mener nous employé ministre santé employé pour travail pour faire clinique ça colposcopie clinique so moun qui ni lab test qui ni a problème pap smear test qui ni a problème ça aide web ça because nous pas vle venir plus grave si nous plus venir grave ça c'est problème ba ou qui affecter femme ça c'est plus là ça c'est shy by so prevention is better than cure ici mais ou connaît à présent les ça fait by vitement parce que té et courir mais pas pour mais pas vle ça mais pas vle savent et puis les fini plus grave et puis nous pour payer plus là et puis peut-être by ka vinn très mauvais nous pas aider et pour kay mort et femme ou kay souffrir. So prevention is better than cure. I know persons are already scared. They don't want to come in for the results. May it is better that you come in for the results so that interventions can be done or made so that it doesn't get really severe. I hope that answers your question, Louisa.
Yes, it does, Doc. Thank you very much. So continue.
Okay, so cervical cancer screening, and I'm looking at the time as well because I don't want to go beyond.
No, you can go over the time.
Okay.
Yeah.
So cervical cancer screening and HPV testing, I just spoke about it. But you know what? We spoke about maternal and child health. If we talk about cervical cancer screening, mais tout c'est by ça, c'est pour madame. Ça pas ouais, madame. Mais c'est normal tout, c'est ici ni normal aussi. And it's important that we look into the men and we try our best to do the best for the men, because the men also are important in our community. And therefore, we had started a clinic before, Primary Healthcare had started a clinic before COVID-19 pandemic. And that clinic was the men's health clinic. The men came in, it was started off, but with COVID, like everything else, all the staff had to be focused or redirected in care for COVID-19 cases that were coming in, you know? So it's important that persons are aware of that. What has happened though with the COVID, the pandemic has gone down, and what we decided to do under UHC is to revamp the clinic, but then add a component where men can come and screen for cancer, prostate cancer. Okay, and that's important. So if you go to like the women, you can call your nearest wellness center and they will tell you what day or where you can get the clinic for the men, what a wellness center, and the men come in and they see the physician, they get a full exam, but they have the option to do a PSA. That is a blood test to give an idea of the prostate, how the prostate is working. If there's a PSA issue, if it's elevated and there's a need to do an ultrasound, we get that ultrasound done at no cost as well. And note when the PSA sample is taken right there at the wellness center. Right there at the wellness center, the ultrasound is done through the wellness center where they give you the voucher. And you can go to any of the ultrasound agencies on island and you can get the ultrasounds done. As well as also you can, if you review the doctor sees you and realize that, hey, this person has a big issue and has to see the urologist is available every other Monday at the Ancestry Wellness Center. Okay, we have placed it in Ancestry Wellness Center simply because the Betty Wells Urban Polyclinic is not ready to accept this space as yet. When the space is ready at the Dr. Betty Wells Urban Polyclinic, which used to be which is currently located in what was the Victoria Hospital, we'll be able to shift that service from Ancestry to place it in an area like Dr. Betty Wells, where it's easier to access. Okay, so right now the men are using these services. The numbers are coming up. They're coming up, and we are happy that the men are coming up to to access the services. We understood that the men, after engaging them and find out why they don't come, a lot of men don't like the finger. You know, we have to push the finger in their behinds, and they don't like the fear of the finger, I call it. And as a result, they were not coming. But now that they don't have to do that, and you can do the PSA test for them, the men are coming, their partners are bringing them in, their wives are bringing them in, the children are bringing them in, and we are happy for this. OK? So c'est nom là, nous savons, nous pas devons oublier ces noms là, nous savons nous faire chay bay pour ces madame là, et nous pas, nous ni pour faire bay pour ces noms là aussi. So ça nous commencer faire, c'est vieux métier clinique là, nous tenir pour nom avant, nous tenir COVID-19. Et ces noms là qui vini, ça nous ka offre c'est yo ka ouais docteur ka examiner yo, et puis là yo fini examiner yo ka docteur non sta ka dit, et ou ni pour faire test pour prostate tout. Avant, c'est nom là te paie, ouais doit là yo ka mette der, yo pas vle mette doit là la pièce, yo paie docteur pour ça. So test là the PSA level, nous ça savent si on a un problème prostate. Et puis là même où ça un test là, yo ça fait test là pour ça un wellness center. Si docteur ouais on peut faire ultrasound, yo ka faire ultrasound là aussi, ou ka ba voucher et pour aller n'importe place cette ici côté yo ka fait ultrasound, yo ka fait ultrasound là-bas ou sondage là-bas ou pour si prostate ou un problème. Et puis si docteur oui mi ou a un problème pour voir ou ça vle yo ve PSA results test là, blood test là, yo ve sondage là, yo de non ça ni un problème, yo ça voir where a urologist wellness center. Now moi vle dou à présent urologist là nous ni a wellness center ka vini chaque lot lady, chaque fortnight lady après-midi Ancillary Wellness Center. Raison nous ka servi Ancillary Slawe is pour ce qui à présent Dr. Betty Wells Urgent Polyclinic yo ka try pour faire arrangement pour place pour clinique ça. Moi à présent place là pour préparer et pour ça nous ka servi Los Slawe Wellness Center Los Slawe. Mais là nous ni a place Dr. Betty Wells Urban Polyclinic Castry, ça c'est côté Victoria Hospital t'es avant, l'hôpital Victoria avant, nous ka mette clinique ça là pour ces moun na ay ces nom là ouais urologist ça. Mais urologist ça après ça ka vini chaque lot lady en la slawe. Docteur non cela yo ka si ou ni pour aller là yo ka couiller la slawe ba ou faire appointment pour aller là yo ka di qui date et qui l'est pour aller sur urologist là ça well si ou ni pour faire biopsie yo ka faire biopsie là ba well. C'est nom là ka vini. Mais vous dire ça avant c'est nom là te ka faire père vini ouais docteur après ça yo petit miette plus boive et yo ka vini madame yo ka vini et puis famille yo issue et puis you can service to them. So this is something that we are very happy about, and we want to encourage our men. Kudos to our men to continue using the services that we are offering at through the wellness centers under universal health coverage. Okay.
So before you go on, I have a question. Is there a requirement before you actually go and do the PSA for the men? Is that you just
well, first of all, before doing the PSA, the first thing the man has to do is to see the physician or see the family nurse practitioner. So we encourage the men to call the nearest wellness center to know when is the clinic and what time is the clinic, and to work with a valid form of ID for registration in the St. Lucian Health Information System. That's important. Depending on what the doctor gets or the family nurse practitioner, they may or may not ask the man to do a PSA. Okay, it depends on what they get on physical examination. Remember, this clinic is a men's health clinic, and therefore we want to examine the man. The man may not have any issue at all with his prostate, and therefore he may not warrant that at all. Okay, now the doctor and the nurse will guide him. There's certain things that they would guide them on doing before they do the PSA itself. Okay, because what you do not want to do is to do certain things, and the doctor will guide them on this, so that what you don't want is an elevated PSA, that's an error. Okay, so the doctor will ask them relevant questions about when they exercise, when was the last time they had sex, or when was the last time you did a DR, the digital rectal examination, and all of these questions, which will determine whether the PSA is wrong or right when the results come in. The doctor or the family nurse practitioner will also inform the patient when to do the PSA. So they will give them advice, prep them, and this is what you're going to do. But for you to do it and to get a correct results, I want you to not do this, not do that, and then you come. So docteur, kay diw, nos la kay la, yo kay diw, ki sa pou fè, ou ki sa pou pa fè, avant yo pitch yo pou PSA. Puisque ça ou pas vle un PSA qui a monté il s'en mi ho et ble ou fini ou quoi on y a un problème c'est pas un problème puisque vous pas te faire ça docteur nos là te do pour faire ou pas fait. So that guidance is given at the level of primary healthcare at the clinic. It's a men's health clinic. It's you examine. You're supposed to be examined fully, but if there is need to do a prostate examination, the doctors and the nurses will be guided accordingly, and they know what to do, and they will inform you of what to do so that you are not you get the proper care that is needed.
Thank you, doctor. I ask this question because, the men like to say the more sex you have, you will not develop prostate cancer and all of these things, they have their own little myths and misconceptions sometimes, especially when they want to go out there. So that's why I asked the question.
That's true. You
follow
don't
the guidance of the doctor or the nurse before
the
the
nurse.
actual
Exactly. And then if you look to people, there are people that will have a lot of sex and they still have prostate cancer.
Yeah.
So you have to look at a lot of things, not only the fact that that doesn't then prevent you from getting prostate cancer. And some people have a very strong family history as well, which contributes to them being having prostate cancer. So I know there are a lot of myths around it. That's why it's good to visit the nearest wellness center as well, so that they can have that one-on-one with you. Okay. So saying that you're gonna have a lot of sex to prevent you. Ça pas vrai, pièce. Ça pas vrai, pièce. Okay. And there's certain things that will guide you. The doctors would, when you go to a wellness center, when they examine you, they give you more information on certain things that you should or should not do to prevent the PSA from coming up. Okay? And just letting you know, sometimes the PSA can be quite normal and you can still have cancer. You have some cases like this. They have a normal PSA and they still develop cancer. So you have to look at the person's family history. You have to look at what the person is doing, the physical, what you get on physical examination, and all of these things before you make a determination on the way forward for that particular patient, which is unique.
Okay, doctor.
Mm-hmm. Yeah. So to continue, more services that we've already launched under UHC, hakuma say launch service basati putut. Lot la c'est moi quoi c'est moun qui sort Soufouye, Swaze, Kanawi, Labowi, Loslawe, Jack Melvana, Pale Miku Denry. You can emeton ça because you savent because nous aller là nous parler puis mais nous savions ni serpent yo serpent shy. I think most solutions are afraid of the snake, of course, but it's not a reality to all of us because none of us live in these areas. So when we go out and we speak to persons who don't live in these areas, it's like they can't believe it. C'est que c'est pas quoi. Mais là nous venons parler avec ces femmes là, autres savent parce que ça c'est réalité, les autres pour nous travailler puis tous les jours. And that's very, very important. Okay. So what we want to ensure is we want to ensure that we have what you call the prevention of being bitten by the snake, which we call the fodilus. Okay, the fodilus, which we call fodilus. The Latin name is Bothros caribeus. Okay, but we call it fodilus. Bala c'est ça. Ministre te pas travail tout seul. Les nous fait travail à sous programme ça. Nous ni pour travailler tout ces moun qui ça aider nous pour faire primaire pour ces techniciens. Okay, so we have the situation where we worked with the fire service because usually the fire service are the first responders, and then when you get bitten by a snake, you can create a fire service là, c'est nom là pour c'est firemen là pour venir amasser yo pour mener yo l'hôpital. So we cannot work without having them on board. They're on board. The same thing we can say for the forestry workers, the forestry and agricultural workers, extension workers, they are very much engaged. The farmers, the forestry or the range officers, they know about the snake, they know about the habitat of the snake. You connais tous ces mouvements séparés. So, nous, en ministère, nous, nous travaillons avec eux. Pour ce qui nous savent, les où travaillent, toutes ces différents, ces moun sa, agency ça, ou ça a une primaire response, ou primaire, manière pour manage, moun ki pitche snake bite. Okay, pitche c'est serpent pitche yo. So we're looking at prevention. So we had to work with them when it comes to the prevention, telling persons what to do and what not to do when they get bitten by a snake, and that's important. We've gone to the different areas, spoken to the farmers, and some of the things they used to do before, like put tourniquet and then suck off the venom and all of these things. We try to tell them pas faire ça, ça pas travailler, ça fait plus mauvais. You're causing infections, you're causing an issue with your leg, you're causing more trauma to the area. So we had to do a lot of work on ground, and we continue to still reach out to individuals, trying to get them to do the necessaries. It has gone well so far, I must say. We've gotten persons being more alert of what's happening and what to do to avoid being bitten by a snake. Understand, I could speak of Mr. Pius Haynes, who worked as he worked with us. He's from Ministry of Agriculture, and assistant chief forestry officer worked with us, and he worked with us to basically inform persons about the habitat and the habits of the snake, so that persons know that what the snake does, what to do to avoid snake bites, etc. And that's very important, because you do not want persons. You want persons to be able to not be bitten by a snake, and that's very important. But what we can tell you under universal health coverage, while we pushing for prevention, we need you to go to the nearest hospital, whether it's St. Jude's or Millennium Heights Medical Complex. Okay, that is important. Nous depuis ça c'est pas picho, nous pour aller Millennium Heights or St. Jude's. Minnesota, we've actually engaged both hospitals to work with us so that we can, and they've worked with us, they've signed a contract to provide a series of the treatment, all the treatment for snake bites. And that will include the anti-venom, the analgesics, the anti-venom, the analgesics, the lab test, or if you have to do any imaging studies like ultrasounds, even the surgery. If you have to do surgery, we'll take care of that surgery. The hospitalization cost itself, because des pour aller dans l'hôpital, ou ni pour payer pour ni couche là pour you ka ba manger, you ka ba déjeuner, dîner, ou ni pour payer pour tout ça. So we're paying for that as well. Mais le docteur discharge you. When you discharge, usually you have to do what you call a follow-up care, where you may have to do physiotherapy or outpatient clinic review. Nous ka payer pour ça aussi. Okay, so nous ka payer pour tous ces traitements ou ka hen à l'hôpital là, c'est ça, soudage là, tous ces bails là, suite l'opération, nous ka payer pour ça aussi. Ba you et puis les ou discharge, docteur ka vie pour manière ou ka faire, peut-être que ni pour di physiotherapy, because your modo pay your modo c'est pas modo pay ou la main et pour pas mouvement ou ka move, nous ka aider and pay ça aussi. We launched on the 18th of February of this year, and Louisa, from the time we've launched, we've gotten 3 patients who have been bitten by a snake. Okay, 3 patients who have been bitten by a snake, and we're looking at one of the patients from Dennery. She was a farmer. We had another one from Laclery who was working in Canaries area, and the third one right there in Soufre. He's actually from the Palmist area. That's his address, but he got bitten by a snake. And we have 3 individuals, but these individuals were not given any bills. They should not have been given any bills at all for the treatment they received under universal health coverage. Yeah. So that's something that's very nice, especially for the farmers in the areas, because these are areas that are snake prone areas. And therefore, it's important that they know that we want them to really understand what they need to do prevention from being bitten by the snake. But if they get bitten by the snake, what is it that we're offering under universal health coverage? And that is something that's important. Breast cancer screening services. Do you have a question?
I was just saying, I remember the all the meetings, committee meetings you were having.
Right.
And why that it relates in the evening as it relates to snake bites and so on. So a lot of persons,
Yes. And then we did breast cancer screening services that we launched.
So, Doc, before you go on, somebody asked, can one go to the wellness center if bitten by a snake?
We encourage persons to go to the nearest hospital. Now, what happens is that if the fire service has been working with us and we have informed them that they need to bring the patient to the nearest hospital. But what I can tell you, Louisa, is that the fire service men themselves, they do their own triaging. And if they themselves have done their triage on ground, because they're the first responders, and they've realized that this patient has to see a doctor to stabilize them, because the patient cannot reach to the hospital as we requested, then it is their responsibility, and they made it abundantly clear to us that they have to go to the nearest wellness center if it's open to stabilize. It happens, yeah? Because if they realize, hey, I need to bring that patient to the nearest wellness center, the nearest hospital, whether it's St. Jude's or Millennium Heights, but this person, they unstable and we're not going to take the chance, then you go to the place with the nearest doctor and the nurse. And if the nearest doctor and nurse happen to be in the wellness center, you will have to bring them there to stabilize them. But what we're trying in our protocol is to advise them to go to the nearest hospital, because we do not want them to delay before getting the anti-venom as soon as possible. Yeah?
Okay.
And when you give somebody anti-venom, you need to monitor them regularly. You have to do blood tests regularly to make sure that you have that you monitoring them, their blood levels, you monitoring what's happening in their blood, and therefore access to a lab and all of these things are necessary. So you really want to bring them to the nearest hospital. Mm-hmm.
Yes, doctor.
Okay. Can I continue? Are there any other questions?
Yes, you can.
Okay, so we also launched breast cancer screening services, and when we launched breast cancer screening services, that would have been around July. We started around ending of June into early July, where we want to offer women a series, okay, of services. Under the health system strengthening project, we got 3D machines, 3D machines, which are mammogram machines, which are state-of-the-art machines. And we placed one at Millennium Heights and we had one at St. Jude's. So what we really wanted or what we pushed for is for the women to get their breast checked, the mammogram done, 3D mammograms, and we pay for the 3D mammograms under UHC. We pay for the follow-up ultrasounds, because sometimes there's the need for the follow-up ultrasounds, okay, as well as other services such as the biopsy. The biopsy has to be done as well as the processing of the samples to know whether you have breast cancer or not. So under the service, we have the 3D mammogram, the follow-up ultrasounds, the biopsy, and we also purchase the needles, the biopsy, and the processing to see whether you have cancer or not. So, nous savons, say, madame, c'est ça. We know that breast cancer is the lead cause of cancer for women, while prostate cancer is the lead cause of cancer in men in St. Lucia. Yeah. So therefore, we have to make sure that we have cancer screening services, which include breast cancer as well. So, say, madame, là, ou sa qui wellness center, qui peut caillou, a community ou savent qui joue, yo ka fait clinic ça, ou sa aller là, is a cancer screening clinic. They'll tell you, the nurses will tell you. When you go there, you should be able to access, they will tell you, give you the necessary vouchers and information, etc., examine you so that you can, depending on whether you need it or not, they will send you to Millennium Heights, OKUH, or St. Jude's to get access to the 3D mammograms, ultrasounds as well. And from there, they will guide you. Because if you have a situation where you have a lump and you have to get the biopsy done, they will give you further guidance at the wellness center on what to do so that you can get the biopsy done and the samples processed so you can know whether you have cancer or not. Okay? So, on peut travailler avec mon wellness center qui a ba information pour nous. Ça pour faire, ou ça, on pour venir là, yo ka qui jou pour venir, qui jou qui clinique là, marcher up ID card ou form of ID qui valide, marcher up ça, so ka mettre ça non on dit dans system registration nous my primary healthcare là ou aller là, yo ka dit qui ça pour faire, qui yo ka ba ou là yo fini examiner yo ba ou tous ces papiers ou ni pour dire ni pour ni yo ka dit aller renouveler ou aller wellness center. Et puis là, où aller à wellness center, you sa do aller à OKUH, ou sa aller St. Jude's, you ka ba ou papier, et puis si ou ni pour ni a biopsy, you ka fait biopsy à ba ou, et puis you ka do sa, qui l'autre ba ou ni pour faire, pour si ou ni cancer. So that's important. The biopsy and all of these things, all of the information on where to get the biopsy done and everything will be provided. You'll be guided by the nurses at primary healthcare. And that's important.
And also, Doc, before you go to St. Jude's, some people, they take the voucher and they go to St. Jude's. Call St. Jude's first.
Very important.
Make the appointment and for them to guide you when you can and can come and do it and so on.
It's
especially
important.
For the ladies.
It's very important that you call in and you make an appointment. The nurses will guide you because a lot of information is given internally to the healthcare workers so that you can give you, because we're really looking also to provide that biopsy services to the private sector as well. That's one of the things we're looking at as well. So we'll work with the nurses. We give information to the nurses at the wellness center, so the nurses will be better able to explain to you, looking at where you live and where you work, and they'll probably tell you where to best access. If you're in the north, we want you to go to get the 3D mammogram at OKUH. If you're in the south, we want you to go to St. Jude's. If you have to do a follow-up ultrasound, you can get it done right there at OKUH or St. Jude's. Now, when you go back to the nurses, if there's need for a biopsy, the nurses or the doctors at the wellness center would advise you on where you can get the biopsy services done. Okay, so Nostra, nous pouvons avoir Nostra Wellness Center, qui est Nostra, yo kay di ki jou pou vini pou se sou klinik la, yo kay di ki jou sa vini la ou vini ID card ou, yo kay pale ba ou, yo kay ba ou papier pour faire 3D ultrasound, 3D mammogram la. Si ou an north la, yo kay di ale Millennium Heights. Si ou an south la, yo kay di ale St. Jude's. It also, you may need a follow-up ultrasound. That is done la même l'hôpital la yo kay fay. Si ou ni a lamp atete ou, c'est Nostra ou docteur à wellness center kay ba ou guidance. Yo kay di sa pou fè kote ou ni pou ale pou tiwe lamp la. Yo kay di tout ça. Because the information is usually, we let the nurses know, the nurses are well aware so that we can guide the patient accordingly. Because every patient is different, and therefore we must really allow them to go through the system. The guidance is important. So we will, the patient has to know, and therefore that's important, the guidance, and the follow-up to cell, as OC. We want you to know as well, because sometimes the patient has the biopsy done and they're very anxious. So it's important that that we work with persons so that they are aware of how they move through the system to get the proper care. No problem on ped. No, we have to follow up with you so that you don't get lost in the system or get so scared and afraid that you don't go to continue your treatment. That's very important to us.
So one question was asked, why is the mammogram so crucial? The people put pain and fear in the patient. That's somebody.
Let me hook up my computer.
Your laptop. Okay, no problem.
Okay, so sorry about that, but a mammogram is important because it is a very good screening tool to find out or to rule out if you're going to have breast cancer, and that's important. Okay, as I mentioned earlier, screening services are important because it will allow us to do early intervention and prevent it from getting worse, where you have to be treated later. And when you're treated later, you're going to be more advanced. Not only will it impact your health and your family and your community, but also it's more costly. It's more finance. It's a lot of more financing. Okay, so that's important. So the 3D mammogram machines that we have is the state of the art that we have, that we got from the World Bank under the Health System Strengthening Project. We've placed one in Millennium Heights and one in St. Jude's so that both the north and the south of the islands can access it. Yeah? So both hospitals has one. We encourage persons to go to the nearest wellness center when the nurses have examined you or the doctors have examined you and they realize this person's need a mammogram, then they will give you the voucher and then you go to the nearest one, whether it's Millennium Heights or St. Jude's, to get the 3D mammogram, because the mammogram is the best screening tool for breast cancer. And we have a 3D one, which is very accurate. Okay, if there's need for follow-up ultrasounds, we're going to cover that ultrasound follow-up as well. If there's need for a biopsy because you have a lump, when you go back to the wellness center of your results, the nurses will advise you on where to go so that you can get the biopsy done. And then, of course, the processing of the sample, which will allow you to be able to know whether you have cancer or not. Okay? So it's a complete package for screening.
So that answers the person which says which hospital undertakes excisions as of breast lumps. So doctors said what the process is. You have to come to our wellness center first, and then they will guide you accordingly.
Yes. All right. You'll be guided accordingly on where to go with your results when it comes to getting the biopsy done.
Yes.
And that's important. We will send out, you get more PR out there, but it's important that the internal guidance is needed, because we want to know, for instance, um, if it's important that we monitor what's happening. So when you go to the hospitals and you get your mammogram done and you get your follow-up ultrasound if necessary, you bring back the results to the nurse will be able to give you more guidance on where to go to get your biopsy done. The biopsy can be done at the hospitals, but also we have one or two other areas within the private sector that you can access as well. But the nurses will inform you accordingly. It will inform you accordingly.
Yes, Doc. Understood.
Yes.
Yes.
Because what we want to make sure that we are monitoring these cases. Want to make sure that we are monitoring these cases. So we will want you to ensure, and we'll be sending out more PR. That's important, Louisa. The importance of PR. The PR will be coming out soon, where we'll be able to give persons more information on what to do, on where to go. But
And where
I'm
to
letting you
go.
know from earlier clock exactly that you can go through your wellness center. The nurses will examine you, and if you have to get an ultra mammogram done, it could be done the 3D mammogram at St. Jude's or Millennium Heights. When you get your results, the nurses and the doctors, they will guide you on where you can get your biopsies done.
Yeah,
Okay,
because
we are using the hospitals. We are using the hospitals for the biopsies, but also we are engaging one or two private sector entities,
okay.
which the nurses will guide you upon, where you can also go and get your biopsies done as well. Okay.
Because the nurses in our region have been engaging persons. So that
Yes.
some persons are not too forthcoming because of persons based on other persons' experience talking about the pain for the mammogram and so on. So they kind of shy away from the
Yes.
service.
So we give you information that the primary healthcare staff has, as well as the hospital staff has, in preparation for the mammogram. Both the primary healthcare staff and the hospital staff, they were given that information. They have the same information across the board. But I'll just let you know that if you know you're going to get a mammogram done, try to take your Panadol or your painkiller 1 hour before you get the procedure done. Okay, because I know the women are afraid of the great. You can PJT or your PMS up, yes. If they say, Madam la nous pay. Okay, so we usually tell them take your painkillers about 1 hour. You already have a IFA procedure, pay. You understand? So the painkillers can help. And also we tell them don't work with jewelry. Okay, take out your jewelry and all of these things, because you know you're going into the radioactive area. We also tell them try to walk with a two-piece and not a whole dress, so you don't have to undress your whole self. You're going to take out the blouse, but your bottom is still on, and all of these little things that we will inform you, that will allow you to be prepared for your mammogram procedure. And that is why I'm telling persons, work closely with your wellness center, because this information has been shared with the wellness center. They have the pamphlets or the brochures or the leaflets to share with you as well. They will let you know so much more, because I know persons are afraid. So we usually tell them, listen, take your painkillers before you, an hour before. When you come, make sure you take out your jewelry and your earrings. And as we say, tout se glan glan, nous c'est madame là, on met marcher per chai glan glan. Tu veux tout se glan glan sous nous avant nous aller faire procédure. Ça, vous voyez, nous devons chai glan glan, chai madame, pas tout, mais nous madame, nous chai, tu mets un petit glan glan sous nous. So we're trying to take these things out, when you're going to do the procedure. If you're going to wear your dress, try to not to wear a dress on that way. Wear a blouse and a pants or a blouse and a skirt. So you top la, may you still have your bottom on, and therefore they can do the procedure on your breast and not have to worry about having you clove up entirely. So these are the little things that the pamphlet or the leaflet would have. Kikai ede se madame la prepare pour faire mammogram là. Okay, but as I urge persons, continue working with nurses, because the nurses and the doctors in the wellness center have the information, and they will be able to give you so much more. They will know you more intimately, more personally, and they know your fears. Okay, because you go in there regularly and you say, okay, this person, say, they could be a person who don't wear any jewelry, and they'll tell the person, they will not have bother tell the person to don't wear jewelry because they know they don't wear it. But if they know there's a lady who loves to wear her jewelry, they'll have to advise this lady, please, on that day, take it out. Don't go in there with it, and when you come out, you can put it on. So these are things that general guides that are given to persons so that they prepare for the procedure.
Thank
Yeah.
you, doctor. Well said.
Also deodorant as well, and all these things we tell them to don't put on, and all of these things. All of these things are part and parcel of the pamphlets or the leaflets that is given, so that persons don't feel um and left out or feel disadvantaged, because you don't want to come with cream and all of these things on your skin. Yeah, you want to be able to do the necessaries and making sure that all is okay.
And I always tell them everybody experience might be different. Everybody have a different pain tolerance and so on.
Very well
So
so. Yes.
I mean, based
Mm-hmm.
on my own experience, I did not have any pain, but some person said it was painful for them. Yeah, so everybody's different. So
Different. Everybody is different, and that's important.
yeah.
And the one-on-one with the physician or your community physician, your nurse, the sharing of information, they'll be able to give you more information, because the pamphlets and leaflets are there. I just mentioned some general ones which are usually there for everyone, but they'll
Yes,
give you the nitty-gritty in preparations, because some persons are very anxious, and some persons they will say they don't have painkillers, and then they will need a prescription to buy painkillers, or it could just be over the counter. So it depends. Some persons have higher pain levels and more anxious, or they have a pain level threshold that's higher than others.
yes,
So
very
it
much
depends
so.
on you. Some persons will complain, others will not. But all of that could be discussed through the wellness center, so you are properly prepared. And the information will be given as well when you call to make your appointment at the hospitals, whether it's St. Jude's or Millennium Heights, they too will remind you on what you should and should not do in preparation. So only you can do day for pas
Yes,
oublier.
yes. The hospital
Ou
do
kade
tell.
de fwa, de l'hôpital la kado, yo l'hôpital la kado, pou ki yo ki ka fe procedure, ok?
Mhm.
Et puis health center ni pou do aussi, pou prepare corps, because ou pa vle just vin la, et puis là ou vin la, ou tell you no, you can't do it. Or you make yourself uncomfortable, and then they have issues with you doing it. So these are things that are important. They can even guide you on when to do it regarding to when you have your menstrual cycle. Okay, they will give
Yes,
you guidance on when in your menstrual cycle you're supposed to do that. And that is a discussion you will have with your doctor or your nurse. And the doctor will still tell you, okay, you're having it on X date. That's when you're going to see your period. I want you to come and do it how many days after your period.
after.
And these are all important notes that you will be guided on when to get the mammograms done. Yeah.
Doc, at what age or what are the requirements? At what age should one do the mammogram? If I mean, for
Well,
persons
we
out
according to our our standard operating procedures, we're looking at 40 years to get it done once every year from 40 to 49, and every other year when you're 50 and above. But if somebody comes with a strong family history, okay, and on examination they realize the person is below 40 and the person has reason to do a mammogram, we will not deny the person. So even though we have a standard operation procedures that says we're looking at 40 years to get it done every year, and up to 49 and 15 above every other year, doesn't mean that somebody who has a strong family history that is below 40 or above a particular age, in the elderly age, we would not do it, because we realize there are deviations from the norm. We have a few persons that may very well have a very strong family history, and they have to be monitored, even though they're not 40 years as yet. So I just
okay,
wanted to make that abundantly clear. Okay,
yeah,
so we don't want the women to think that, I'm not going to get it done because I'm 40. If you have a strong family history, or you think that there's something wrong with you, you should really go get yourself checked, and the doctor or the family nurse practitioner might realize that you have to get it done despite the fact that you're not 40. So this is something that's very important, yeah, to note.
yes. Thank you. I just wanted to I just
Yeah,
want you to mention that sometimes some persons are at high risk, and based on examination during the pap smear,
exactly.
when the nurse is doing the self breast examination, she realized one of things that warrants concern.
Mm-hmm, mm-hmm.
Therefore, they might, yes.
They might very well decide to ask you to come in and do it because of your findings and your strong family history, and they say you're not 40. Pan kon at lan ni, me ba la se sa famou tata titi ni mama ou te ni papa ou ni cancer tout li moun. And I also want people to know that men can have breast cancer too, eh?
Oh, yes,
Okay,
for
not in a
sure.
very large percentage, but you have a
Mhm.
very small percentage of men, maybe just about 2% from what the literature says, that can get breast cancer. So I don't want the men to think that they are out of the loop. They may not be as it might not be as frequent in them like the women, but there's a small percentage of men who do have breast cancer. Okay, that's very important.
Yes,
The
sir.
other thing we wanted to let persons know is that there's a PBF pilot project, performance-based financing pilot project, which is currently running in 17 wellness centers on island, more in the rural areas. Okay.
Yeah.
Some of the areas may include areas close to you, right there, Louisa, where you are, where they may
All our
have some
well-
of the
all
wellness
our wellness
centers.
centers, all our wellness centers run the PBF
Great.
program in our region.
Exactly. So it's important for persons to note that this particular service under the PBF program that offers screening and treatment for hypertension and diabetes, this service will continue as a pilot project on October until the middle of October, but thereafter it will fall under the wider UHC umbrella. The wider UHC umbrella. And that's important. Okay, that's important that persons note that it will be falling under the wider UHC umbrella, meaning that the PBF methodology will continue, and also we
Nice.
plan to expand. So it's not only going to be in these areas, but we plan to expand to other parts of St. Lucia where St. Lucians can benefit from hypertension and diabetes screening and treatment, where they get their free labs, and the free drugs under that PBF methodology. So I just wanted to say that that's one of the things we have upcoming under UHC as part and parcel of our activities. We also looking at if we're looking to colon cancer screening. We know colorectal cancer is another issue in St. Lucia. Actually, it's we having a few numbers coming in, and therefore it's important to screen, because when you can screen, it's important to screen. So makay di sa part 1 nou sav yon ni yon de wellness center an won plasa kote yo ka bay tout moun ki ni nou ka screen, nou ka chache moun ki ni pressure pi sa dou. Ep si ou ni pressure pi sa dou, nou ka ba ou med, nou ka fe lab ba ou, tout sa ka fet a wellness center. A ba UHC, program sa ka vini a ba UHC bon finas Oktob. Nou ka pre servis sa a ba UHC ki pli gwan. Ba la se sa nou vle tout set lisi receive kalte kasa bénéfice ça. Il paraît fait yon fois nous kay fait tipa parce que nous voulons tout le monde recevoir service ça côté ou ça pressure et puis ça do ça pour que ou tout ces bail ça nous kay fait tipa nous savent yon place qui ni chay moun ko astri ni chay moun ko zine ni chay moun babou non ni chay moun et toutes ces places là pour en dedans yo pour commencer recevoir qualité service ça so ça kay pour un petit temps mais ça c'est bay nous ka veiller pour faire about UHC. Moi vle moun savent tous aussi nous ka veiller nous ka travailler pour commencer screening pour colon cancer, colorectal cancer. Ça c'est un autre qualité cancer qui est là et qui a monté et nous pas ministre pas faire mes yeux ya sur ça. Nous ka faire ça pour faire when it comes to screening pour moun vini screen. Remember moi te hadi le ou chasser et pour jouer li bonnet ou ça faire ça on pour faire pour éviter venir pour bli mauvais à son, because prevention is better than cure. So this is another cancer we're looking at to be able to do more for persons under universal health coverage. Okay, now Louisa, while I'm saying all of these things, because these are a lot of services and there are more and more and more services, you in the back of your mind you're going to say, but Dr. Eugene, kote nou ka hen la pou pay pou tout se service sa. Okay,
Yes.
and even though you thought about it, I'm pretty sure some of the listeners would probably say, if you don't, you have to pay for these services, okay? Because if you don't pay for these services, then how you continue, how you sustain. So, Minister Tebiete Ebzafeg Wamun, we've engaged JIPA, which is a company to work with UHC project to be able to focus on UHC financing. Okay, and this company that hails from Miami, they're working with us and they've been with us on the UHC project from October of last year. Depuis Octobre l'année passée, you ka travail avec nous et puis you ka travail à sous manière qui manière nous ka payer pour service ça. Nous a commencé by cette lycée et puis comment nous ka pay pour tous ces services-là. Nous voulons continuer by cette lycée. Because remember in the beginning, I spoke about a basket of services. A
Yes.
basket service at the time. So therefore, we need to figure out comment nous can pay pour service a basket pour tout. So we've been working with Dr. Ned and his team under JIPA, And then basically the concept is simple. I try say it as simple as possible so that persons can get to know. It's a basket. We're looking at a pot, which we call a special fund. A special fund where we have different people contributing, or different agencies or different means of contribution to that fund, that special fund. And I want you to think of that special fund called Go Pot Bouillon. Because go pot bouillon because you successfully say bouillon. We like big pots
Yes.
of fish, okay? And into that special fund, we have a whole bunch of persons who are contributing, or agencies that we are looking at to contribute into that big pot that we call the special fund. So you know that the government of St. Lucia usually gives money for health care for St. Lucians. So that amount of money will go into the special fund. You know, we have the health and security levy. Some of that money can go into the special fund. You know, NIC contributes, some of that money can go into the special fund. We're looking at other things like sin taxes. And when I say sin taxes, we're looking at alcohol, cigarettes, we have all of these things can contribute to the special fund. We have tourists coming to St. Lucia. If they can contribute, even though it's a small amount, even though it's $5 US, they can come. And I think it's good as well, because when you start looking at it like this, it will allow St. Lucians to know, and even tourists to know, that if they come to St. Lucia and something happens to them, they'll be able to receive care because they have contributed to the special fund. And there are different contributors that is being thought of in that proposed model to finance UHC. So all of these contributors are in the fund. There's also what you call a UHC authority that they're thinking about, an agency qui travaille pour conduire l'argent. When I mean conduire l'argent pour ka, you have a UHC authority that'll be working to be able to pay the healthcare services. So depending on the service or what's happening, the money will go to the service providers. The service providers can be anyone from primary healthcare, which are service providers. You have hospitals that are service providers, and you have the private sector, which are also service providers. So the UHC authority will be the one responsible to use that special fund, that big pot where monies are coming into, to be able to pay for the healthcare services that St. Lucians are receiving. Of course, a lot is being done to encourage persons to be able to work with that module, in that we have had stakeholders consultations, we've gotten feedback from persons. The stakeholders consultations continue because persons must understand basically the contributions that has to be made, and how tier 1 is important because it's in 3 tiers, and depending on the services, the tiers, then persons will be able to, the UHC authority will be able to know where the money is coming, where who will be getting the money. So we plan to give primary health care persons the right to primary health care, the right to the essential package of services that I mentioned at primary health care, where they will go, and that money will be allotted by the special fund, so persons can go through there and get the services. And as you go up, if you go to the hospital, then there's a slightly different way in which you will handle the funding. Okay, and if you have to be airlifted out of St. Lucia because you have a disease that takes you away from our shores because we don't have services on island to treat you, that will come with a slightly different type of funding. So all of these 3 tiers would be managed by the UHC authority, and the services available will vary slightly and paid differently, but all will be managed by the UHC authority, will be responsible for the management of not the management, but the payment of healthcare services. The UHC authority will be focusing on payment of UHC the services, which is called financing of UHC. How do you finance the UHC services? So it is a authority that will be, we already discussed. We have a first draft of the bill. We are continually meeting with various individuals. The stakeholders consultation will continue because we have persons that we plan to continue meeting: the Minibus Association, the Vendors Association, the Farmers Cooperative, the Fishermen Cooperative, and the Civil Society Organization coalitions. And all of these are important grassroots persons you need to meet to continue engaging them so they can know about UHC services. They can know about the basket of services, and they know about how you're going to pay the services with if you have the UHC authority, how would the UHC authority pay for healthcare for St. Lucians? looking at this special fund and how it's going to go through. So it is something that's ongoing. We know that everyone has to be informed and involved. We've done a lot of stakeholders consultations, but it's important that persons are aware of the UHC, what is being offered, and how we're going to fund UHC and the model that's being proposed. Yeah, so it's an ongoing. This started. We've done a lot of sensitization, but it has to be ongoing. And the important thing about UHC is that you have to keep people informed. Keep people informed. Keep people informed, because the UHC authority will be financing, will be dealing with how do you pay the service providers to finance UHC. You want to finance UHC, so they are engaged in financing or dealing with the finances related to the services offered under UHC. So that's important that persons understand the services and the proposed method of financing UHC. Yeah.
Doc, I'm so happy you said that, because a lot of persons don't understand. These tests are very, very costly, some of them. When you add all the PBF tests together, it costs a few $100 and so on. So, I mean, it's a lot. It's a lot of money being paid out. And I'm so glad you spoke about the finances so that people can understand how it is being paid, and they can well appreciate the effort that is put into it. Because sometimes they feel, oh, that's just government. No, but it's a process. It's a process. It takes a lot of thinking. It takes a lot of, like you said, collaborative effort between so many sectors. So when you get these services, we need to appreciate it, that it's given out there, even if it's free, but there are people out there working for you to make it happen. Yeah.
Right.
So,
And it's I also want to say, Louisa, as I said earlier on, this is universal health coverage is where World Health Organization wants countries to go towards. Even the COVID-19 pandemic, the countries that are more advanced with universal health coverage, they really did better at fighting COVID-19 versus others. Yeah. So we saw the importance of how UHC would have played such a great role and make us more resilient and more robust to deal with what the demographic shifts and drifts when it comes to diseases. The epidemiological shifts and drifts, sorry. But I'll tell you one thing though. Importantly in UHC, and everything we do is engagement. Nous ne pouvons pas parler avec public là. Nous ne pouvons pas parler avec moun là pour yo connaître qui ça nous ka faire ba santé pour tout UHC. And therefore, nous ka commencer by ces services là. Nous ha commencé nous plus service pour bay à ba santé pour tout au UHC, mais nous ka travail aussi qui manière nous ka payer pour ce service là. Nous ha commencé bay et puis ce l'autre service là. Nous voulons bay ces moun nan ba santé pour tout. As I told you, we're working on there's a first draft of the bill. We have already started engagements. We'll continue. We have to continue engagements with many individuals. We want everybody in St. Lucia, as many persons, grassroots, all different levels, to understand about UHC and basically understand the different ways in which we're going to, how we're going to pay the services under UHC. Okay, we have a 3-tier model that when we meet individuals, we basically explain in detail, and we want persons to, if they're invited or when we come to the community or when they're invited to special meetings that very well may happen through their workplaces or the agencies that they attend, because we'll be able to explain even better the 3-tier approach of how we're going to pay for UHC services. Okay. We think that it was an opportunity for persons to be able to give their feedback, to understand, and to have the buy-in, because everyone is important and everyone in St. Lucia will receive the benefits of universal health coverage. So ça c'est ba qui très important. So là nous venir en village, là nous venir en place, là nous parler avec ces moun là côté quoi travail, là nous inviter nous pour venir en meeting là. S'il vous plaît, venir en meeting là pour comprendre ça nous ka fait. Pour moun comprendre comment nous ka bay ces moun nan service là, qui service nous ha ka ba UHC, qui l'autre service nous voulait bay en plus, et puis comment nous ka payer pour service là nous ha commencer bay ces moun nan ba santé pour tout. Ça c'est ba qui très important parce que nous voulons tout le monde connaître, tout le monde ni pour là pour savoir ça pour faire. Nous pas voulons moun nous voulons tout le monde dans cette liste comprendre ça nous ka fait ba santé pour tout. OK, so mlèv le moun, lè nou alè se radio a, lè nou nou meti meeting la, lè nou alè a visit village la, lè nou se lot se plas la, nou vle moun vini, kompren sa nou ka di, mè de kwestyon pou ski nou sav, sa nou ka fe a prezan, sa se pou tout set lisye. Tout moun an set lisi. Ni pou hen si servis la, an ba sete pou tout.
Okay, thank you, Doctor, so very much. Any other thing you want to add before we leave?
Just to let persons know that, first of all, I'm very happy, Louisa, as I said, okay, earlier on, that you have invited me to this forum. I intend to continue using Casualty 911 when invited again, to be able to add this to our list of persons, because I know the persons who are listening on are usually in the West Coast area,
Yes.
but I'm pretty sure they have others around St. Lucia who are listening too. I think it's an opportunity to be able to reach out to persons, to let them know what we're doing under UHC, keep them informed, keep them involved, and therefore we can continue that collaboration. I'm pretty sure that they have their feedback, they want to know about what's happening, and we will reach out to persons so that we can do our sensitizations, have our meetings, so that persons are very much involved. But I want to encourage persons, the services that have already launched under UHC, to please go to call your nearest center, nearest wellness center, so that you can benefit from these services, have your colleagues, your friends, your family benefit from these services. Give us feedback on how the services are doing. Because that's the only way we can improve it. If we know it's not working for you, or you think there are ways in which we can ou sa pale pse non sta ou ka jikouye, ou sa jikouye minister TBT zafè gwa moun, okay? You can call 4685300, 4685300. You can ask for the Universal Health Coverage Project Unit, and we'll be able to find out how you feel about the services. We are also reaching out to persons ourselves as part of our program, part of our project. We reach out to persons to find out the work plan, basically how satisfied are you of the services. That is one of the things we do. We have persons we call, we do telesurveys, we find out how you're satisfied or not with the services and what can be done to improve the services. But if persons want to volunteer and call in, we appreciate that as well. And with that, I say thank you so much, Louisa, and thank you, Casualty 911, and for Sufra and the environs for being big patient and allowing me to say a bit about Universal Health Coverage Services and a bit about financing UHC.
Thank you so very much, Dr. Eugene. It's always a pleasure. Like I said, we're hoping that you will come back in the near future to educate the public about the services that are being offered by UHC, so that they can get a better understanding of the importance of the services that are being offered. Again, thank you to all our listeners out there. Do have a pleasant week. And now is the ideal time to go to our wellness centers and to ask our nurses, our wonderful nurses, about the services that are being offered under the UHC program. All right. Thank you so very much, Romanes, for assisting us today. We know that, at the time, but you stuck by us, and Erlan, good day to you. So everyone have a wonderful day and do take care. Oh, by the way, welcome back, Fawn. Welcome back to work. I hope you had a very good vacation, and do enjoy your first day back at work. Thank you, Rose.